Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Happy Q&A day today. Do like to celebrate wins in the Concussion Fix program. So we do have a couple of wins this week to celebrate. It started the program at 74 out of 132. And in 6 months was down to 4, which is extremely, extremely low, even on the recovered scale. So yay. And then started at 88 and in 3 months is down to 23, so not quite recovered yet, but she had emailed in being all excited about it, so I really want to celebrate with her and have her in this because she was excited to circle back and now redo the new program at this lower scale of 23 and really seeing how much further down she can bring it with the new program, which we always recommend if you're at the end and you still have some symptoms, come back because you're ready to take on more and maybe, see some of the teachings, the strategies that you didn't pick up the first time through. And now with our new program that just launched this week, you have a whole new program that you can do that with, which is absolutely exciting.
Yeah, we're super excited to have everyone participate in that. Give us feedback. We're always looking to improve. This program, as Nikki said, was built based on your feedback and people that have gone through the program before you. And that is what I think has made the program that much better. So not only our clinical experience and all the research that we've reviewed, but also all of your feedback. So we're excited. We're excited to get that feedback soon. So
and I know a lot of people have started it yesterday. I was looking and I have seen quite a few people were in the new program yesterday, which is really, really exciting.
Awesome.
So yeah, please let us know any thoughts, ideas, anything like that as you go through it. We would appreciate it. But otherwise, we can start with our first question.
Good morning. Thank you for taking my question. And my success is automobile accident on March 29th. I was severe on 5/24. That was shortly after I started your program. Down to moderate on July 7th. And I'm looking forward to testing again, but I'm progressing very nicely. My question, I have 3 questions if you don't mind. Is there any diagnostic that could tell if my gut flora is normal? Question number 2 is a couple sessions ago, doctor talked about his recurrent rash, and it was a histamine, high histamine. And apparently there's some supplements you can take, histamine blockers. And number 3, I have an inversion table, and of course I haven't gotten on it, where you go upside down. Can I start using that or no? Those are my questions.
Okay, so I'll take the first 2, and then the inversion table may be more of a question for Dr. Cam because he's looked at that in a little bit more detail, so we might have to wait for that until we get back, okay? So let's tackle them in order here. So you mentioned something about the histamine. So histamine, as we talked about either last session or last Q&A or the Q&A before that, it can become elevated, and it can play not just allergy issues and rashes and those types of typical histamine-like reactions, not just environmental allergies where you would take an antihistamine, like for example, Reactin. We also mentioned the idea that it also is a neurotransmitter, and it does play a role in cognition, brain function, focus, sleep. One of the side effects of antihistamines is that it actually sleeps. So there are a number of substances that you can do, that you can take that may help reduce it. Now, I will tell you right off the bat, they are not as strong as any of prescription or over-the-counter medications at blocking histamine, but they have maybe less side effects. Quercetin, I'll write it in the chat for people that are interested in knowing a little bit more or knowing the spelling about it. Quercetin is a substance that's found in fruits and vegetables, like for example, citrus fruits in the rind, and there's different onions are very rich in quercetin as well. Much smaller amounts than you would get in a supplement, but this substance can help stabilize mast cells so they don't produce as much histamine. So that is one way of decreasing histamine. But I think my final recommendation to the person that asked the histamine question a couple sessions ago was anytime you're dealing with something like mast cell activation syndrome, which is what that question was about, and then histamine, you really want to work with a healthcare provider that is well-versed in dealing with this, because there's some advanced testing that can be done to really determine, do you have this type of situation, this type of condition called mast cell activation syndrome. There's a spectrum of how histamine intolerant a person is. Some people just can't tolerate histamine that are found in foods. And histamine does accumulate in foods. For example, meat products, especially anything that's fermented, anything that is aged, like aged meat that's out for weeks, has much higher histamine levels than something that's fresh cut. So there could be just intolerance to histamine. And the second supplement I was going to mention is something called DAO. And this is an enzyme that actually inactivates the liberation of histamine in the gut. So sometimes if people have gut histamine issues, then they can use this particular substance. Now, again, a lot of people might be asking, well, how do I know if I have that? And that, again, comes down to that healthcare provider, that either functional medicine doctor or naturopathic doctor that can guide you in that. This actually is a good dovetail into your first question about advanced GI testing, because there is certain stool testing that can test for inflammation at the level of the gut. There's a marker called zonulin. Zonulin is an indicator of leakiness of that particular gut membrane. We can also look at immune activation. You can look at good bacterial levels, bad bacterial levels, parasites, fungi. There are a whole bunch of different types of stool tests available. Again, these are only available through functional medicine or naturopathic doctors. The stool testing that's done by gastroenterologists does not pick these types of functional markers up. They do not do these microbiome assessments. These are much more comprehensive. What the gastroenterology or family doctor stool testing does is they look at, do you have a very specific set of parasites or bacteria that are causing chronic GI issues. Usually there's a tremendous amount of stool changes, like loose stools, that are causing this, and that would trigger them to do these types of tests. So there's a big difference between conventional testing and functional testing. I will put a link to one example of these tests after I'm done answering the question, so you can take a look at that. Does that answer your question?
Oh, yes, absolutely. That was great. And the last question is the inversion table, and you said we're going to wait on that one, right?
I just don't have any experience with inversion tables. It's not my area of understanding or expertise. So I think this is a great one for Dr. Cam, and I don't think Melinda really knows much about that.
Okay. Thank you so much. I sure appreciate you guys. You've saved my life. You brought me out of my brain fog. God bless you all. Thank you.
Thank you. God bless you too. Okay.
Thank you and good morning. I had a couple of questions. I actually have a lot, but I'm going to focus on like the hormone stuff. I'm still working through all the modules, and I generally need to watch the videos 2 or 3 times. And I've just done the hormone module once, but I have an appointment with my primary care doctor tomorrow, and was going to ask for some of the testing and stuff. I think, and I have some visual and auditory processing issues, so I know I've probably misunderstood something. But I went and I printed out, like, there's a sheet, or I found there's a sheet or there's a resource that lists the different things for the doctor to maybe look at. But it didn't seem to match up with some of the stuff that I remembered, or it definitely didn't talk about like checking over a span of time versus, like a day or a week versus just a one-shot thing. Can you provide some more information for that? Or it doesn't look like all the things that were talked about in the video are on the sheet.
Are you talking about the hormone testing? Sorry, I want to make sure I understand what you're asking.
Yeah. So like there's like hormones and cortisol and the thyroid stuff and all of that.
Okay, so what you're saying is that you're thinking that the lab testing letter that is in the resources doesn't cover all the other tests that are actually discussed in the modules. Is that what you're asking?
I think so. And then like it doesn't talk about looking at it over a period of time versus
Right. Okay. So I think I understand what you're saying. All right. So this is the document that that is in the old course as well as the new course. This one was not substantially changed. Okay. So just to make sure everybody understands, this is a document. By the way, is this the document you're talking about?
Yes.
Okay, perfect. All right, just wanted to make sure. Okay, so this is the document that is meant to be as a guide and a resource to share with your primary care provider. There is all this testing is in their realm of understanding. There is some testing that I talk about in the hormone module, like for example, the 4 or 5 point cortisol saliva or urinary testing that they would have no clue about, or they would not really have access to that testing unless you're working with a functional medicine or naturopathic doctor. So I don't actually I haven't summarized all that advanced or additional testing. This letter or this document is meant to be as a guide to say, hey, you could even give it to your primary care provider, say, I know that you may not understand this fully, or this is not something that we've talked about fully before, but this is why I'm hoping that you can help me with this testing. So this is all blood testing. Okay? The additional testing has not been summarized. Does that make sense in terms of differentiation?
Yeah, that's helpful. And that my primary care is very willing to work with me and very open to looking at things. So is there, to get to a functional medicine doctor, is there like a place or a resource that we can look at to find somebody that's credentialed correctly, or because I know there are a lot of people out there that maybe are not. I'm trying to be respectful when I ask that. I mean, I don't want to go to anybody that maybe doesn't. I want to also have somebody that has some experience with TBI, so they know exactly kind of what to look for. And I think it probably comes later in the module, but I don't know. Do you guys ever work with anybody, or how does that work?
Yes. So we'll answer both your questions. We do work with patients that are in Ontario because that's where our licensure allows us to practice.
That's true. Okay.
So unfortunately, I couldn't work with somebody from Texas, unless they come visit us here or they have some sort of address that they can use here in Ontario. The issue is that every state and every province, and again, I'm talking about North America. Europe is a whole different, and Australia is very different. But it all comes down to it's not just that we can't legally do it. We just don't have the ability to even order these tests there because their lab wouldn't even take my requisition. So it's like if I want to treat somebody, I want to be able to practice the full scope that I'm able to, right? And to be able to help you, because that's not fair to the patient. So there's a practical reason, and then there's a legal regulatory reason. But that doesn't mean that patients haven't come and seen us from all over around the world to get advice on, okay, we have this testing. So to answer your question, is that naturopathic doctors and functional medicine doctors, people that are that have the additional training to help interpret these types of tests, they're hard to find, because it's hard to find someone that understands concussions, and then not just concussions, but also the hormonal impact of concussions. That's like a really rare unicorn. Now they exist, and I will send you a resource that could be helpful, but this is a very limited resource. There's a training program that we are working on, but it's still in its infancy stages. And Dr. Marshall has trained many chiropractors on how to do the manual side of things, similar to what he does. And I've helped also with that training. However, they are not functional medicine doctors, and they're not naturopaths. So that network doesn't fully exist yet. So really what most people do is that they look around locally in their city, in their state, wherever they are, and they are going to see who is practicing naturopathic and functional medicine. And then they kind of like look at their online presence, they look at their website, they look at some recommendations on maybe support groups that are local, and being like, who has worked with someone that has some knowledge. But you don't necessarily need someone that's a concussion expert to help you. What you really need, if you have hormonal issues, is someone that understands hormones, and they're able to test and guide you through all the things that I talk about, the additional tests in the actual program.
Just a clarification question as I've been listening here. Did you say that your family physician, you said she or he is very willing to sort of work with you? What was his or her response to some of these recommendations here in this letter? Were they able to run the testing?
We haven't done that yet. I have an appointment with her tomorrow. Several months ago, she just checked a couple of basic things. We did do like a cortisol saliva test, but it was just a one-time thing. I did it in the morning, and I think she expected it to be elevated, and it wasn't. And after watching the video, that's probably not, you want to have a higher amount in the morning than what you do.
Yes, totally.
I think because I've suspected, the more I learn more about hormones, I've suspected hormones and cortisol and stuff like that. But she's willing to do them. She just doesn't know exactly how to order some of them or what she's looking for. So,
Right.
yeah.
I think this letter will actually help with that, though.
It will.
Yeah, where it's like, okay, this is why we're doing it. The biggest obstacle is that doctors are like, if they're willing to work with you, they just don't know maybe why they're even requesting something like, B12 or prolactin or some of these other things that I had on the list. While they did morning cortisol, that's great. That's really just going to determine, like, are you producing any at all? And you clearly are. The saliva or urinary testing just gives you a lot more nuance and actionable items. I'm like, okay, so how does it change? Like, is it starting really low? Is it starting really high and then coming down? There's like a lot of nuance. You need multiple points during the day. And to be honest, conventional medicine, in my experience, really, really doesn't do well with adrenal testing, period. They don't fully understand it. It's not sensitive enough.
Yeah. Yeah. She was really struggling on how to even order the cortisol. The saliva test in the lab didn't really know anything either. So when I went and so then would you and I'm trying to get as much done, and I know I need to get to somebody that knows what they're doing, but as much done through the insurance that I have. So where functional medicine and that isn't covered by traditional insurance, unfortunately, but I know that that's where I need to get to. But so would you recommend like if my primary care can run these tests, but then getting to an endocrinologist or gynecologist to look at the hormone stuff, or
So the way that at least in the kind of modern conventional medicine, is that your primary care provider is the gatekeeper. So if they have any reason or evidence that something is off in the hormonal front, they'll make that referral. Rarely will they make the referral just based on a hunch. They usually need some sort of evidence, because on the flip side, the endocrinologist's office then would rebuttal back and say, why are you sending me this patient? You're wasting my time, and you're wasting, other patients' times. And that really is not what a family doctor wants to do. It kind of burns a bridge. They don't want that. So I've repeatedly heard this over and over in every specialty. Rheumatology being like, why are you sending me this? This person is not really a candidate to be seen by the precious time for the specialist. So that's a challenge, and that's why I think this letter will be helpful to kind of get cast a wide net to get any sort of dysfunction that is going to be hopefully caught. This is where, again, that functional medicine naturopathy doctor can give more insight, where they're like, okay, so we've done more detailed testing. Yes, it costs money, but if there's a strong clinical suspicion, then it may be fruitful then to kind of point the family doctor in the right direction. Like, many times I do additional testing on inflammation, and the family doctor has not done that. And then I send them back to the family doctor saying, hey, I suspect something's going on. Can you run additional inflammatory tests or retest their testosterone? And if it's low still, bingo, they have reason to treat or refer.
Okay. All right. Perfect. Thank you.
You're welcome. It's pretty faint.
Okay. My audio was being really weird, so I switched to my laptop. Hopefully it's good enough.
It's a bit better now. I think you might have got closer to it.
Okay, no, I'm me again. Bit of a setback in my journey here. I'm fortunate actually to have seen yourself, Paul, and actually was working with Dr. Sean Sutton in your clinic. Talked to Dr. Cam a little bit about like what I was experiencing with Dr. Sutton, and said, hey, I seem to have symptom increases, and kind of a big spike every time I get treated. Is there a way I could get treated by yourself, Cam? And he actually agreed. So I went all the way to Oakville, and Cam had a chance to work on the neck, and to say the least, like, it has destroyed me. Like, I feel worse than I've ever felt. And I don't necessarily think that's because of anything Cam did wrong, but I got decimated by this treatment. And so sort of like really, my symptoms are visual and brain fog and kind of, the neck seems to be a big component. But I guess I have two questions. One would be, what could be happening that prevents my body from like responding well to manual treatment? Like, I guess I believe wholeheartedly that the neck is the big one for me, as evident by my symptoms. But I seem to just get destroyed by manual therapy. And the second one, which is pretty new, is, I would say that a lot of my symptoms were, like I said, brain fog, vestibular. I didn't really have I didn't really feel like the mental health piece was really one that I struggled with. Like, I didn't have huge amounts of anxiety. I do struggle with OCD, but I didn't really have much OCD in respect to the concussion stuff. But since getting treated, I'm so anxious. I actually started the new program, and it said, like, you need help, man. Like, you're depressed. Like, I don't know. I did that testing. It's called PHQ. But is there? I guess my second question would be, like, is there a tie between, the neck dysfunction and maybe like my body's response and like increased anxiety and depression?
Yeah, I can start if you want, Dr. Paul. This is a really, really common experience. And oftentimes when people go get rehabilitation treatment, it's when they realize that they might not be ready for it. So that's a really common experience we've observed in our populations, which with PCS, because oftentimes if you're experiencing like hypervigilance in your nervous system, or your nervous system is dysregulated, it's likely that getting a treatment like a neck treatment is going to be even more activating for your nervous system. And what happens is that, in the language that we use in the course, we get bumped outside of our window of tolerance, which means our nervous system becomes overactivated or underactivated as a response to stress. And that's going to actually create a plethora of other symptoms. It can bring on anxiety, it can heighten mood challenges, it can heighten things like ADHD, it can create all sorts of challenges. It can also dysregulate other systems in the body. So sometimes, just loosely, of course, this is painting things with a broad brush, but loosely, if you do experience a really negative reaction to a rehabilitation technique like a neck treatment, and of course, it's not like an injury from the neck treatment, it's unlikely that that is typically the cause. It's more likely that your nervous system had a really strong response to the treatment. And that just points to underlying dysfunctions, starting with nervous system and mental health challenges. So even if you had some sort of like underlying anxiety or worry about it, this can create an environment for things to get heightened after a neck treatment. I remember we had this one great live maybe 6 months ago, where we talked about feeling safe with your provider and having really open communication with your healthcare provider as well. Because if they're trying something new that you're not sure about, or you're not sure you're going to feel safe, and your nervous system is kind of on edge when you go into the treatment, this sets us up to have a big flare in our symptoms as well. So this is something that we've come to know very much through our client population. So you can try that on and see if it fits for you. It's also outlined, like you said, very well in the new program. We do have those assessment scales that you can take, not to be alarmed, right? If it says you're depressed, that's part of your picture right now. It could also be due to this event that you just had that was very distressing, right? So
if I had filled it out
go ahead.
kind of before, like maybe even 4 weeks ago, I don't think I would have filled out the same way.
Yeah. Right. So depression, clinical depression is 2 weeks of persistent symptoms, but it doesn't mean that you're going to get stuck there. It just means trying to make sense of what's happened and why you're there right now. So I would keep listening to the new program, because you're going to glean a lot of information around why this might happen when you get rehabilitation. And if Dr. Cam was here, he'd say, remember our Concussion Fix pyramid, rehabilitation is at the very top.
Yeah.
So working right from the base of this, building your strong foundation. And you can think of this flare you've had, or my perspective would be, this flare you've had is a sign of underlying nervous system dysregulation, perhaps some anxiety or depression, that just needs some attention first before working on some of these rehabilitation components. Dr. Hrkal, would you like to sort of add or expand to that?
Yeah. I mean, Michael, we've got to know you quite well. Obviously, you and I have worked together, and now you work with Dr. Cam. You've heard Dr. Cam talk about the possibility of a flare aggravation after any sort of manual care, right? And so I remember in our previous conversations very recently, it was like, okay, so let's just really see what's going on with your neck and see if we can reproduce it. So my question to you is, when you had this treatment, is the flare because because the symptoms increased after, and you have health anxiety around it, which we've kind of talked about before? Like it's almost like a bit of a PTSD response, or is it that actually the pressing on a certain area in your neck triggered those symptoms, and it's not so much that anxiety response? Or thirdly, like Melinda mentioned, is it just that it's an overstimulation period, and now we're dealing with an autonomic nervous system, like sympathetic parasympathetic nervous system imbalance issue? So there's almost like 3 separate things that can be causing this. So can you help me unpack that a bit for you?
So I think it was my theory is that it was a real physical response. Like I felt actually, honestly, very optimistic going into it. I was really excited to see Dr. Cam, because I believe in you guys and in him. I did feel really tired, I would say, after the treatment. Went home and did feel quite fatigued. And then over the course of the next few days, like really tight. And then I would say my my mental state declined, because I suppose, we come into this program and think, I've tried everything, but this is going to be the thing that works. And then you sort of get through it, you implement some of the things, and then you go do some rehab with the guy who is the expert, and you just get wrecked. So that can be, I guess, discouraging. And I think, but like, I don't necessarily think it was simply just an anxious response. Like, there is a real physical, maybe inflammation or like physical response to the treatment.
Yeah.
Um,
I would say based on that, it actually, my interpretation of that is that it's not a physical response. It's it's more of a nervous system overstimulation. And then the subsequent, as you just pointed out, I went to go see the guru, the expert, and I ended up not having the expected hopeful response that I had. That is now playing on the psychology. Remember, I outlined 3 possibilities. One is I press on an area and it makes my headache 1,000 times worse. That is that is a direct, referral pattern. That's option number 1.
That did happen during the treatment.
Yeah. And so that usually happens, and then it kind of like subsides, and that just tells us, okay, you know what, Michael, you have an issue there, and we need to tackle that. And one treatment is just diagnostic. It's not curative in any way. The second one is that fatigue you experience, that's like a nervous system, I'm overwhelmed response. That's your autonomics. And then the third response, this is in Melinda's area, which I know she's probably going to want to chime in on here. That is the interpretation of psychologically what you're going through, the increase in symptoms, the increase in pain, the expectation, and the result, the delta there. Melinda?
Yeah, well, so I word nervous system reactions as a physical response. So I would group those together because a nervous system reaction is physical. Often all we feel is what's happening in our bodies when our nervous system's dysregulated. Less often are we aware of what's happening emotionally. So that would just be my only kind of expansion there, is that nervous system responses to stressors like getting a neck treatment following concussion, that's a sensitive thing to do, right? There's a lot of bravery and courage you need to build up in order to get a neck treatment after a head injury. So that nervous system response is still showing, it can still show up as physical symptoms. So not to write that off as it's a physical experience, but that our emotional and physical experiences can happen in tandem or one or the other to an extreme stressor or a stressor that is very sensitive with regards to our specific injury. So I think kind of sometimes even just a reframe like that, recognizing that all these physical responses that you're experiencing can still be nervous system dysregulation or like a heightened nervous system response to a physical treatment. I hear this all the time in my practice. People who go for a treatment, whether it's acupuncture, massage, neck treatment, and it doesn't even have to be in the most sensitive area. It can be anywhere, right? Just a general massage can create a nervous system response. We're making a shift in the body. So if we're already in a heightened state, and by heightened, I mean a dysregulated state, which is very normal to happen following concussion, then we can have any of these symptoms: physical, emotional, mental. And then to add on to what Dr. Hrkal was saying, that a mental and emotional response, that third bucket he's talking about, is sort of the aftermath response that can be a little bit clearer in our experience. So really kind of capitalizing on what Dr. Hrkal has said here, when we recognize that our expectations aren't met, then we can have a downturn in our mood. So there's this hopefulness, we get this treatment, I have a nervous system response, I don't like the nervous system response because it's not making me feel better, now I have a mood response. So they're all connected, right? So I like these buckets that Dr. Hrkal's describing because it helps you to figure out that pathway to getting where you say you are now, right? This place where everything just feels terrible. But perhaps seeing whether or not you can go with it right now I don't know if right now you have like a restriction in your movement, or there's extreme tension in your neck, or what's going on. But one thing we know is that when we can work and double down on nervous system regulation, so calming the nervous system, supporting anxiety, supporting the quality of our thoughts when we think something's going wrong in our body, we are going to improve. Because when we're spiraling in our mental and emotional well-being, our physical symptoms are going to spike and increase and make it seem like this treatment caused this horrible response and everything is worse. But that's not the case. I've really outlined this in the new program, and I even put arrows to each thing, and it should be quite easy to read, because one of the things I recognized when recording the first program was how that can be missed, right? There are these physical and emotional mind-body responses that can create a lot of panic and overwhelm for people, when actually it's just a physical response to an emotional and physical stressor. So we can kind of start to unpack that and settle in knowing that it's not a point of panic for ourselves when that happens. It's just a sign that you created a change in the body, the nervous system had a response, and now we need to do what we can to support the nervous system to regulate again.
Right. Yeah, I guess I didn't necessarily consider or narrow in on the ANS, because exercise, actually I don't really have a lot of exercise intolerance. I passed the treadmill test, and actually I would say that like post exercise I feel the best. So I kind of thought, oh, maybe it's not autonomic, but is that necessarily true, or that's not necessarily a true statement?
Yeah, I don't think you have dysautonomia. I think that is ruled out by being able to pass those tests. However, I think, I really like Melinda's explanation. Those three buckets are helpful. And maybe instead of saying physical, I should have said structural as being the first one. So if there's like a structural response, is there a nervous system dysregulatory response? And I think they all are interconnected. It's hard to like totally pull them apart, because the psychology affects physiology and vice versa. So you can't totally extricate them like this is purely psychological, this is purely structural. There was a structural input that influenced your nervous system, and that changed symptoms, and that influenced your psychology. And then they all now are influencing each other. So at what string are you going to pull on? So I don't think it's helpful to look at this as like, I have dysautonomia. I think it's helpful to look at this as an explanation of why you were symptomatic and why you felt fatigued. That most likely is to do with that autonomic dysfunction temporarily that led to some of those symptoms. I mean, the thing, I want to turn this conversation into, what can we do about this? How can we help you out, and focus in on, where do we go from here? I think ultimately what we always counsel everyone that has this type of response is you have to go back to the person that did that treatment. And so I wish Cam was here to kind of help.
Yeah, I'm going back, and I'm not going to stop going.
Yeah, like I think actually this is a good sign. I know you don't want to hear that, and people get frustrated when we say that, but you've been kind of stuck from everything you've shared over the last months. You've kind of like, and you're not really making progress. Like you made a lot of progress in some ways, but now you're stuck. So finally, we've kind of like stirred up the bee's nest here a little bit, and you're triggered in terms of physiology. I look at that being like, okay, wow, there clearly is something here that has created this big response. Well, we're going to have to go in and remedy that, because there's never been this type of response in recent time. So there's something there that drove this. And as you said, the solution is talk to Cam. He's going to modify his approach, and we're going to see if we can now not get such a strong response, but still try to address that dysfunction.
Yeah, and Dr. Cam knows about building safety. So you can say to him, hey, I had this response. So it might just be a bit of a different approach he would take with you to say, okay, we don't want to trigger you, right? That's unpleasant. Not that it's dangerous, just unpleasant if your nervous system goes into, an overactivation or underactivation type of response. However, it's important that you feel safe in the work that he's doing. So now that you've had an adverse experience and things flared up, what your physiology will do, which is also connected to your mental health and your emotional experience, is you're going to tense up the next time you see him. So bringing that up with him before your next treatment is super important, because it makes sense if we've had a trigger, we'll call it, and all of a sudden now you're apprehensive, you're going to go in there like this, and then he's not going to be able to do any good work on your neck. So I think there's going to be this great dance that the two of you can do to sort of support this building the foundation of safety that I talk about all the time, to help feel safe in getting this neck treatment and calming things down after this response that you had. And then the second piece that, of course, this is my area, I highly encourage is really working on the grounding techniques, really working on bringing down that nervous system response. Oftentimes, all of those sort of underlying mental health pieces really flare up when we've had an adverse response, especially for hypervigilance to physical symptoms. So I like that we're making this distinction, Paul, between our two languages. And with physical, I'm almost thinking maybe more specifically, we could ask members about, well, where's the response? Is it only in the neck? Because often a nervous system response flares up all sorts of stuff, right? Like cognitive slowing. You might even feel shaky. You might have old pain spots that flare up that have nothing to do with concussion, right? So there's this broad spectrum of what physical responses to an emotional or physical trigger can be.
Yeah.
So I like that we're on this train. It's going to get me thinking about a few ways to explain it in the future.
Yeah, I mean, definitely not just the neck. Like, I would say at my best since joining the program, like my symptoms were really visual for the most part. Like I would say I've had days since joining the program where the vestibular stuff was pretty okay. I didn't feel super off balance, or the brain fog was subsiding. But then, the treatment has definitely kind of brought all that back, and maybe even, worsened it to a certain extent. So yeah, it's definitely like even my ankles, everywhere kind of seems off. Like there's like that kind of that out of it feeling. You just feel like, wow, I don't even know where I am right now. Like,
yeah, that's a real sign of nervous system dysregulation, right? If somebody works on your neck and your neck flares up, okay, maybe there's something got tweaked. You need to go back and kind of massage out something that happened. But when we have a response to a neck treatment and our ankles are sore and our whole body's out of whack and we're feeling disconnected, right? We're having a full body response. That's, definitely could just be mental and emotional as well. It can be mental health related, but it can also be nervous system dysregulation.
The unique thing about myself, which was that with before I even had concussions. Like, I do have OCD, and I do find, like, obviously one of the behaviors in OCD is to test. And okay, I have this treatment, I don't feel super great, and I'm in this cycle of testing. Like, I'm basically analyzing how I'm feeling, what I'm feeling at every moment, every second of every day.
And what does that do, right? It kind of reinforces those sensations that are uncomfortable, right? We're bringing a lot of attention to them by checking on them.
Okay, so I guess summary. I'll definitely speak to Cam. Establish that sort of dialogue. In terms of, like, I suppose I always struggle with what's enough, like, in terms of, okay, meditation and those tools, to be honest, the foundational part of the program is actually the most difficult for me to implement. I'm still working. I can't really afford not to work. Still working. Got 2 kids under 3. So, like, those pieces are really difficult. Staying consistent with the diet, staying on the supplements, finding time to do the stress reduction techniques. So I guess, like, I always struggle with, like, am I doing enough of those things, and when do you know you're doing enough of those things?
Yeah, I mean, I think we're getting more into, like, the specifics, and I'm not sure. I recall us talking on lives a few times. Do you have a therapist that you're seeing? Because OCD is an anxiety disorder, and so if we're working on the underlying condition that might flare up during times of stress, some of the questions you're asking us would be very appropriate for a mental health professional to support you.
I don't, but I'm in Ontario, so I could always connect with yourself.
Yeah, we have a Psychology Today live that we did. There's also a handout in the new program that you can download to look for someone specific to anxiety, OCD, post-concussion. But that is a real challenge when it comes to recovering from concussion, particularly if you're in persistent concussion symptoms, is if you have an anxiety disorder, you're almost like working double time to try to recover, whereas sometimes there's a benefit in decentering from our symptoms, not focusing so much on them, and that takes a specific skill set. So if you're having trouble getting through my modules on their own, like on your own, it's probably going to be most helpful to work with a healthcare provider, and I've outlined that as well. So going through the modules that I've outlined can give you an overview of how anxiety and conditions like OCD can actually make it harder to move forward with your PCS recovery.
Thanks.
Great. Did we want to go to the chat question before going back?
Yeah, there's a couple of them in there. Nikki, you want to read them out for us?
Yeah, absolutely. I started taking fish oil recommended by my concussion clinic around 10 months ago, 1,000 milligrams, which has 100 milligrams each of EPA and DHA. In February, I got a notification on a Fitbit re a possible AFib attack at night that I was unaware of. Later got an ECG and it was normal. So doctor and I figured that maybe it was just an artifact and it never happened again until July 20th. This time I was aware of my heartbeat and felt sympathetic discharge all one night with poor sleep, and I got another notification. This one I am taking more seriously. GP has ordered Holter monitoring. I am wondering if this could be caused by the fish oil, even though I was taking a low dose and have stopped taking it. If it was triggered from the fish oil, would stopping it resolve the situation? I have had no symptoms in the past 2 weeks.
So, I mean, having 2 episodes of AFib, I think it's prudent to, you want to evaluate why they're happening, but it's not like they're happening consistently. And I think two episodes in the span of over 6 months is not that much at all, and not really a cause for concern. Now, the Holter monitor will help you. If you're not experiencing any AFib during that time, the Holter monitor will be normal. There was a study published in 2021 that did find that there was a connection between using 1 gram of fish oil a day, which sounds like what you were doing, 1,000 milligrams, that did increase the risk for atrial fib. And this could be happening, but again, like I said, maybe I would pause the fish oil until you finish the Holter monitor, and then you can either restart it or choose to not do it. But that's probably it's possible, but unlikely, I guess I'll say.
Great. There was also a question about when should someone start the new program? So a lot of members are partway. Some have just joined. Some are partway through. Some are close to the middle. So for any of our members who have already in the original program, when should they switch over to the next one?
Well, I think, Nick, you did a great job describing when you should do that. So I'll defer to your answer. So please.
Yeah, to me it was, as soon as you can. But if you joined maybe a few weeks ago and you're still within those first few modules, switch over to the new one. There might be a little bit repetition because you just listened to what Dr. Marshall says in the education piece, but he does expand a little bit more and has it a bit more concise. But to me, if you're close to the end, absolutely finish off where you're at. If you're already in the rehab section, finish that, and then you have your new baseline, and then now re-go through it, the new one with, a more of that open mind to see what has changed, and you're more able to take on that information that you may not have been ready for that first time through the program. Now, for those, because there's a lot of people who've actually messaged who are around your nutrition part. So they're like right dab kind of in the middle. And to me, that's kind of, I just would want to go see what the new one's about personally. So I would say go to the new one. And because again, you've still already improved quite a bit, most likely. So you're going to be getting all kinds of great new information. I know like Melinda's section has really, really expanded. And there's a lot of information. We've brought the sleep down, so you're going to get the sleep even beforehand. So even if you're in the nutrition part, I say go to the new one, because I would just also just be too curious to not be able to not go to the new one.
Yeah, I was kind of curious about that too for people who are like midway. So someone in the chat said, "Hey, I'm 62%." And I was thinking, most people go through the program twice, right? So finish up, right? If you're almost there, 62% is more than halfway. And then start the new one, right? Most people are going to go back and start again because there's so much information in this program. So yeah, I mean, it's a tough one. But if you're halfway, that's where we're stuck too. Like, what do we recommend for you? I think, keep going if you're more than 50%. Otherwise, maybe switch over. You'll be a bit of like, there's going to be some duplicate information, like you said, Nikki, with Dr. Cam's sections, but also there's a lot of new research and updated, and my section has changed substantially and expanded. So there's a lot more of landing right into our nervous system and how we can support our nervous system more directly, as well as learning sort of like how people have come to develop PCS and really building that baseline of understanding what's happening in your mind and body. So it's a tough call. I think we'll be experiencing this for a few months.
And there is no one right or wrong either, right? It's that individual, what is going to fit for your schedule, your needs, in your lifestyle. Like if the thought of, oh my gosh, I have to restart the program is too daunting, we don't want that. That's why you continue to have access to the original course, because we didn't want to force anyone to, okay, no matter where you're at, bam, you're done that, onto the new one. We didn't want that. We don't want to create that stress and anxiety. So continue where you're going. If you're someone of the mind frame that this is going to be stressful, to restart. However, if you're someone who's just too curious, and even if you are 60-70% of the way through and you just want to restart and go to the new one, absolutely do it. So that's where knowing your own personality is going to come in and really important as well. All right, you can ask your next question.
All right, thank you. And I put my hand back up because I didn't see anybody else putting their hand up. So I got back in line. And my mind is still processing a lot about the nervous system dysregulation and that. So I'm on the hormone section. So I'm probably getting ready for the rehab part. So I'll go back and I really want to focus in on some of the nervous system stuff. So I'm looking forward to doing that. But my question is, and I'm probably going to put you on the spot. And I know you can't answer things specifically, and I don't have like my lab tests in front of me, but some of the things that have been off on my lab tests is my primary care has been looking at things. My liver enzymes have been elevated, sodium levels have been low. Can you, and I know there are a lot of factors that go into that, but she doesn't really have a good answer for either of them. In your experience, is there an area that you might focus in on looking at something more in depth, or?
Yeah, the sodium and liver enzymes are not necessarily connected. Generally, sodium has to do with hydration. So usually drinking too much water dilutes the amount of sodium in your blood. And so that's one possibility. Some people with autonomic dysfunction can need extra sodium. So we talk a lot about that in the POTS and the orthostatic hypotension sections. That's under the umbrella of autonomic dysfunction. So that's one possibility. Liver enzymes, they can be elevated due to as you said, a whole bunch of different things. It could be due to a medication, a supplement that you're taking that has some effect on the liver. It could be due to having fatty liver, which is a huge issue, even people that are not necessarily majorly overweight. And so those are we first look at the most reasonable and the most common reasons why you actually might get those dysfunctions. But that in itself doesn't really indicate anything that's related to concussion or preventing you from concussion recovery necessarily. So I would just trust the primary care provider on evaluating each one of those markers and just guiding you on that.
Okay. Can I ask you a question on the POTS and on that?
Mhm.
One of the things when I was in a car accident, and one of the very first things that, and I have always been a person that does like heavy salt, but I just like craved salt, and I suspect more and more about autonomic dysfunction and possibly POTS and that. Um, but I have that salt craving, and I continue to do that, and I am getting a lot of probably way more sodium than needed. So that was just a thing that stood out. I couldn't understand why my sodium was low. But how do you proceed, like looking into that POTS diagnosis and that further? Or
Yeah, so it's partly a testing factor. So there's a couple different tests. The best one is kind of what's called an active stand test. So you're lying down for 10 minutes, and then you're taking your blood pressure and your heart rate, and then you stand up and then you measure your those same factors, blood pressure, heart rate, immediately. 2 minutes, 3 minutes, 5 minutes, 10 minutes. So you're seeing if it's going to go, if your heart rate on standing is going to go up by at least 30 beats per minute in that timeline. And if it does, then that's one of the diagnostic criteria for you have some sort of postural orthostatic tachycardia. Fancy way of saying your heart rate goes too high when you stand up. And that's indicative of autonomic dysfunction. So that would be the testing that anybody could do for you. That could be your chiropractor, that could be your physiotherapist, that could be your primary care provider. There really isn't many autonomic specialists, and these are extremely difficult to get into, and they're the worst people, the worst of the worst. Just from a big picture perspective here, people that have POTS, actually bona fide POTS, they are very dysfunctional. They have trouble getting out of bed. They have trouble functioning, doing activities of daily living. If you're able to get up and go about your business during the day, and you still have symptoms, of course, that there's a good chance that you don't have actually full-on POTS.
okay,
If you're able to do basic exercises like Dr. Marshall, I know you're about to get into that, so I do think that you should really look at that. Dr. Marshall in his section does talk about POTS, so you're going to have a lot more explanation about that and what to do. But like this past week, I had a patient that came in and said, "Oh yeah, I have POTS," and I'm like, "Okay, let's test it." Didn't have POTS. The symptoms for autonomic dysfunction are so wide and so generic. A lot of times people will read it online, or they'll put it in Chat GPT, or they'll hear about it on a blog or a YouTube video, and they're like, "Oh yeah, well that describes me perfectly." But the actual diagnosis is much more specific and usually much more severe, because there's just a whole bunch of symptoms that can qualify or fit under the category of POTS, but you actually don't qualify for the diagnosis. But you may have autonomic dysfunction, and that's different than dysautonomia. And this is where it gets a little confusing, because there's all these terminologies: autonomia, dysautonomia, sympathetic nervous system, parasympathetic, vagus nerve. We're all like, okay, there's got to be something wrong with this, because I have all these symptoms. So hopefully that kind of like organizes a bit better for you.
Yeah, you can
okay,
think of it
thank
as
you.
a continuum. Like it's a continuum of autonomic dysfunction, whereas dysautonomia and POTS is on that far end of extreme autonomic dysfunction. So not to say that you don't have it, but it's unlikely to be at that severe end if you're still able to kind of move through your day relatively normally. So autonomic dysfunction can, let me know, Dr. Paul, if I've got this right, but from my understanding, autonomic dysfunction can be temporary following concussion, but it can also happen following setbacks, or if you get sick, we can have these flares in autonomic dysregulation or autonomic dysfunction for a time being. And doing things like regular walks, helping to support your nervous system, are all going to help regulate autonomic dysfunction. So it could be, right, that you have some autonomic dysfunction, but remembering that there's a continuum of severity along autonomic challenges.
Yes.
That's perfect. Thank you.
Great. I think that's a great spot to wrap up today. A lot of great questions. Again, thank you for everyone who is coming on, asking questions. We always appreciate it. Have a great weekend. Bye.
Bye, everybody. See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.